Cotard delusion. Imagine waking up one morning absolutely convinced that you're dead, not metaphorically, not spiritually, but literally deceased. Your body? Just a rotting corpse walking around. Your organs? Definitely not functioning. Welcome to Cotard delusion, where patients genuinely believe they've died, but somehow keep existing. Jules Cotard, a French neurologist, first described this condition in 1880 when he encountered a patient who insisted her brain and internal organs had disappeared, leaving her nothing but an empty walking cadaver. Modern medicine classifies this as a rare neuropsychiatric disorder that can follow traumatic brain injuries, severe depression, or schizophrenia. One of the most famous modern cases is a man known as Graham, who after a suicide attempt became convinced his brain had died. Brain scans showed activity in his frontoparietal regions had decreased to levels typically seen in people under anesthesia. Graham would visit cemeteries because he felt a connection with the corpses buried there. The truly terrifying part? People with Cotard delusion often stop eating, bathing, or taking care of themselves. After all, why would a dead person need food? Some even request to be taken to morgues because they believe that's where they belong. Treatment typically involves antipsychotic medications, electroconvulsive therapy, and addressing any underlying conditions. Many patients eventually recover, though the road back from the land of the dead is long and difficult. Capgras delusion. Your mom walks into your room looking exactly like she always has. Same smile, same voice, same mannerisms. But you're absolutely certain she's not your mom. She's an imposter, a perfect duplicate who has somehow replaced your real mother. This is Capgras delusion, where patients believe that people close to them, typically family members or spouses, have been replaced by identical-looking imposters. Unlike most delusions that fade with time or evidence, showing photos or sharing memories doesn't help. The belief is unshakable. One heartbreaking case involved a man who, after a car accident, became convinced his wife had been replaced by multiple different doubles. He kept photographs of his real wife from before the accident and would compare them to the imposters, sometimes becoming violent when the fake wife wouldn't reveal her true identity. What makes this disorder particularly disturbing is how specific it is. Patients typically function normally in all other aspects of life, making it all the more confusing for family members who just want to be recognized as themselves. Dissociative identity disorder. Formerly known as multiple personality disorder, dissociative identity disorder remains one of psychology's most controversial and misunderstood conditions. Despite Hollywood's dramatic portrayal in films like Split, the reality is much more complex and usually less theatrical. People with DID develop distinct personality states, or alters, each with their own patterns of thinking, perceiving, and relating to the world. These aren't just mood swings or playing pretend. Brain scans have shown actual physiological differences when different alters are in control. DID almost always develops as a response to severe childhood trauma. The mind essentially fragments itself as a survival mechanism. If one part of the psyche experiences something unbearable, another part can take over. Thanks for watching. Don't forget to like, subscribe, and hit the bell. See you soon here on Narrative Dimensions.